Hey guys, welcome back to the Fun Facts About Fasting series. Today is episode 3. I'm talking about how fasting and cardiovascular disease are quite related. So, with the notion of cardiovascular disease, I don't need to show you stats, reports, and effects of cardiovascular disease around the world because we know it is the leading cause of mortality. So, i.e., one of the leading conditions that are so troublesome for countries, for people around the world, surgeons, clinicians, you name it. When cardiovascular disease comes up as a terminology, we naturally get worried and nervous, which is why strategies or approaches to try and reduce risk factors that are related to cardiovascular disease is something we all want to look at. And fasting, believe it or not, is such a great way to curb key risk factors related to cardiovascular disease, which I'm going to be talking about in this episode. So the three things I'll be focusing on in this episode is looking at the notion of blood pressure in relation to cardiovascular disease, looking at fatty acid metabolism, cholesterol, and fat loss as a factor as well. And lastly, which is something I'm very interested in, is insulin sensitivity and how insulin resistance plays a key role in cardiovascular disease, but how fasting can actually help to reverse it. But I'll save that to the end of the episode. Now, in terms of blood pressure, we know categorically chronic high blood pressure is a problem and one of the biggest factors in relation to developing cardiovascular disease. But funny enough, fasting actually helps to not just lower blood pressure, but to regulate it. And what do I mean by regulating blood pressure? So actually a recent study in the Journal of American Heart Association, I think 2019, so quite recent, looked at over 1,610 participants and looked at their blood pressure in relation to fasting. Roughly half were looking at slightly hypertensive, and the rest were looking at more normotensive. So they have within the guidelines of normal blood pressure, but towards the higher end of it. And it actually has some subpopulations of that study, well, what we call hypotensive. That actually had quite a concerning low blood pressure than what should be the average. And believe it or not, what they found was the long-term fasting actually helped to regulate. So what I mean by that is those who were hypertensive, their blood pressure reduced. Those who were on the higher norm of normotensive also reduced. But funnily enough, those who were hypotensive, their blood pressure increased within to the normal range. So that's what I mean by regulation. And long-term fasting can help to try and minimize the use of high doses of antihypertensive drugs, which we know can have side effects long-term. Also be used as a standalone therapy potentially to prevent somebody who might end up having medication. If they do some form of fasting, it can potentially prevent that need, which is also really useful. Looking at it from the fat side of things, or one analogy I like to use is imagine a car with an engine, and then you put in tons and tons of weight into that car. The car has increased in weight, but the engine hasn't increased in power. So now the engine has to strain and work at a higher rate to move that car along. And that's the same thing that happens when potentially we increase our weight. Our heart has to pump harder and faster, which increases blood pressure, which is what I just mentioned in the first part of this video. So we know that that's quite simple to understand, that reducing our weight naturally will alleviate the workload on the heart, so we can have a better chance to minimize our cardiovascular risk. But what I want to mention is something a bit more interesting, and that is the notion of cholesterol and blood cholesterol. Now we know cholesterol is a little waxy substance that our body, our liver produces. We do get it from foods as well, but it's useful for maintaining the cell membranes, maintaining fat-soluble hormones, and even helping in vitamin D. But something that's really interesting to know is that when that blood cholesterol increases in levels, that it becomes a risk factor for the next step. So it's not that blood cholesterol can be a huge problem on itself. It can be, but it's when there's damage to the blood vessels that that high cholesterol then starts to become a problem. So how does that high blood cholesterol become a problem? I'm going to tell you now. Insulin sensitivity. And what I mean by this, I'm going to help you follow through my train of thought and see if this actually makes sense. When there's a lot of glucose in the blood vessels, you end up having that insulin resistance. So where the insulin like, I can't do this anymore. So there's a desensitization, there's a resistance to it. Meaning, lots of more sugar and glucose are circulating around the body, which can be damaging for the blood vessels. So you've got this high level of glucose damaging the blood vessels, causing damage to the endothelial cells, damage to the blood vessel wall, then starts to cause ruptures and increase in inflammation. Then that can potentially serve to build up blockages, atherosclerotic plaques, where now that heavy, high cholesterol starts to get clogged up. And that clogged up can lead to thrombosis. Then if that's happening in your actual heart, can lead to damage to that muscle and potentially myocardial infarctions. So fasting can actually help to reverse insulin resistance and actually reverse that desensitization, so increasing insulin sensitivity. So I might have gone slightly over 5 minutes, I do apologize, but hopefully you enjoyed those little 3 parts of how fasting can help to reduce risk factors related to cardiovascular disease. So imagine fasting is kind of like a multifaceted approach to curb our potential risk factors related to CVD. Again, just changing the way you eat. Pretty cool, right? Cool. I'll see you in episode 4. Take care.